One thing that will be open this President's Day is the Pismo Beach Veterinary Clinic, right?
Yes.
We got Dr. Joel Conn here as Ask the Vet, our twice monthly segment here, and you're open 7 days a week, right?
That's right.
Never closes down. Okay, so February, it's President's Day. A lot of talk about the president, but it's also National Pet Dental Month.
That's right.
I probably didn't know that, but a lot to talk about in terms of dental health for pets.
Yeah, so this is a month where we always try to educate pet owners and people out there about their pets. And the big tip of the day today is lift the lip. So most people don't look in their pet's mouth, and except for the little dogs that are licking you all the time, you might peek in their mouth.
It sounds kind of dangerous depending on what kind of dog. Well, I guess if it's your own dog, maybe not as much.
Yeah, don't lift a stranger's dog.
Right,
so,
exactly.
Your own dog or your cat. Take a look. Signs of dental disease are there if you're looking for them, and statistically, about 85% of all pets over the age of 3 have some degree of periodontal disease, which is pretty significant. And if you think about it, we always like to talk about pets' age in human years, right? So roughly 7 years to a dog year. So if you think about it, if you have a 7-year-old dog that's never had, gone to the veterinarian for dental cleaning, you've never brushed their teeth, that's like a 49-year-old person that's never brushed their teeth, never gone to the dentist.
Yeah, you can only imagine what
and
damage.
The dental disease is comparable, and believe it or not, we see some pretty crazy things. Signs of dental disease: bad breath, of course. That's one of the first ones that kind of is up in your face, but a lot of times we'll see loose teeth. If you actually lift the lip, you can actually touch some of these teeth, and they're literally hanging by a thread in some cases. Wow. Bleeding of the gums, difficulty eating. Now, it takes a lot to make a dog or a cat stop eating. So I don't use that as a major symptom, because I have a lot of people say, well, he's still eating great. Well, these guys are pretty tough. Yeah. And dental disease really generates a lot of chronic pain. It's not really acute pain necessarily. So they may, in most cases, still be continuing to eat, even if their teeth are really bad. Drooling excessively, and of course, decreased appetite. So I think we've got some images here of kind of stages of dental disease to take a look at.
Oh boy, here.
Here we go.
So dental disease is staged from 1 to 4. So this would be stage 1, and this is where we really want these guys to come in for a cleaning. You can see there's a little bit of redness at the gum line, and there's a very scant amount of tartar. And tartar is basically hardened bacteria. It's mineralized bacteria. Stage 2, you start to see more puffiness and redness and new blood vessels at the gum line. So if you touch this gum, it'll blanch really quickly and then come right back bright red. You can see there's a little bit more tartar developing here. This is still a tooth that we can probably save at this stage. And again, this is where we want to get them in early rather than later for preventative maintenance. Stage 3, now you've got roots showing. You've got what's called furcation. This is a 3-rooted tooth, and you can see right in the middle there's like a divot there. We're actually starting to see between the roots
right there? Yeah.
On this tooth. The gums are obviously, in this case, painful. There's a little bit of pus there. This is not a good scene. This is a tooth that probably at this point is no longer savable and may need to be extracted. And this is stage 4. This is beyond help. And unfortunately, the vast majority of patients that we have seen historically come in here. And on Monday, I had 2 dogs. I extracted 42 teeth between 2 dogs. That is not what we want. We want to get them in when they're 3, 4, 5 years old. We want to clean those teeth and we want to save those teeth. And the best thing you can do at home is make sure that you're aware of it, and of course brushing.
Okay, so I was going to ask you real quick. Best thing you can do, brushing?
Brushing is great, and it does take a little bit of practice. Have your veterinarian give you a demonstration. The key with brushing is you work up to it slowly and you make it a happy experience. And if you do it right, you can make it a really kind of a bonding experience. I have some dogs who really look forward to it. Even a cat. I have a friend's cat who will jump up on the counter at night to get their teeth brushed. That's unusual.
I would have to see that to believe it. But that's a very well-trained cat. We appreciate Dr. Joel Conn. Ask the Vet at KCOY.com for any of your questions you have for him. We'll see you back here in a couple weeks.
Thank you.
We'll be right back. Stay with us.